Hello, my name is Richard Cho, and my formal disease presentation is on social anxiety disorder. My ID is 14561. And as you can see on the first page, this is just a picture that I found online with the source at the bottom. So, first, we're going to start off with the pathophysiology. So, persons with performance type social anxiety disorder have greater response of the autonomic nervous system. And the neurotransmitters that are involved are serotonin, dopamine, and glutamate. In addition, brain imaging shows increased activity of paralimbic and limbic circuitry. Also, certain temperaments of toddlers and maternal stress has also been shown to be associated with social anxiety disorder. So now we're moving on to the signs and symptoms. So the DSM-5 diagnostic criteria for social anxiety disorder says that in order to have social anxiety disorder, a person must have marked fear or anxiety about at least one social and or performance situation where the individual is exposed to possible scrutiny by others. In addition, anxiety, fear, or avoidance is persistent and lasts longer than 6 months. Some signs and symptoms of social anxiety disorder includes individual fears showing anxiety symptoms or acting in a way that will be negatively evaluated. Social situations typically provoke anxiety or fear. Social situations are avoided or endured with anxiety or intense fear. The anxiety or fear is out of proportion to the actual threat posed by the situation. And lastly, this last part is specific for performance related SAD only, which is fear is confined to speaking or performing in public. So the next slide is kind of like a treatment overview. So for SAD, first line is SSRI, and the FDA approved SSRIs are paroxetine and sertraline. In addition, another first line is Effexor, extended release, and the second line options are benzodiazepines and buspirone, and these are meant to be augmented with SSRI or SNRI. And last line would be gabapentin, pregabalin, and phenylazine. Okay, so this next is kind of like a treatment algorithm. So pretty much at the top, if you can see my cursor, it says social anxiety disorder. When we go down to the second bubble right below it, first line, like we just talked about, is the SSRI or venlafaxine XR, and you're supposed to treat for 12 weeks. And then if you go to the left of that box, it says pretty much if there is a response, you're going to continue the treatment for 6 to 12 months. And say we go all the way to right over here to the partial response. So let's say there's a partial response, then what you wanted to do is augment with buspirone or clonazepam. And say there isn't a response, so you go down the middle. What we're going to do is switch to another SSRI or venlafaxine XR. And say there's an inadequate response, what we're going to do is switch to phenylazine. And once switched to phenylazine, if there isn't a response, what we're going to do is switch to gabapentin or pregabalin. And say there is a response to either one of these treatments, what we're going to do is just continue the treatment for 6 to 12 months. And so this next slide is just for performance related social anxiety disorder. So the treatment of choice would be beta blockers, which include atenolol, tenormin 25 mgs to 100 mgs, or propranolol, Inderal 10 to 80 mgs. So for the beta blockers, you're just going to take 1 hour prior to the performance event. And like I just said, it's only for performance related SAD. And to the right, I have a picture of someone who seems like they're a little anxious, nervous while they're performing. The prevention of social anxiety disorder, pretty much cognitive behavioral therapy with or without pharm therapy, as we discussed in the previous slides. And I thought this was very interesting, but pretty much to prevent SAD. Many patients with SAD do not realize that they have a treatable illness and therefore do not seek treatment, which is why patient education is an essential part of treating and or preventing SAD. Okay, and the prognosis and monitoring, like in the algorithm, what we're going to do is treat for at least 12 months. And for the first 2 months, we're going to check every 1 to 2 weeks if there is a treatment response or there's intolerability to the medication and or if monitoring is required for medication therapy. After the first 2 months, check every 1 to 2 months. We're also going to assess for suicidal ideation at every single visit. And for patients on beta blockers, we're going to monitor blood pressure and heart rate. And these are my references. Thank you very much.